Welcome to our Men's Health panel discussion. My name's Fiona Reid from the Rural InReach program, and on our panel today we have Dean Dwyer, Dr. Paul Poulet and Heath Black. Welcome, gentlemen. If each of you could perhaps just give a little bit of an introduction and background about yourself, we could start with Dean.
Thank you. Fiona, it's fantastic to be here today. I'm very excited about this, and I want to thank you all for organising and setting it up at the outset. It's a wonderful opportunity. So I'm the president of MAN, which is a peak body for male health and wellbeing here in WA. Been there for about 4 or 5 years, and perhaps for about 15 years now I've been both interested in and working in and with males of all ages around their health and wellbeing, and more particular lately mostly around adult men, middle-aged men, I guess because now I'm a middle-aged man myself. So, but that's about enough about me.
Thanks, Dean. Paul?
My name's Paul Poulet, did a PhD on blokes, looking at how blokes care and how to bring that care forward in their lives. Worked with Dean really closely over the last several years, and have been working also with Heath. It's been a real privilege, and delighted to be here today to talk about what's happening for guys out in the rural regions.
Thanks. Heath?
My name's Heath Black, and thank you very much for the opportunity. I was an ex-AFL footballer. I was in the industry for 12 years and retired in 2008 prematurely due to my own mental health and wellbeing issues. I now work for One Life, which is a suicide prevention strategy of Western Australia, and we're in rural areas, and also with Headspace and an ambassador of MAN as well, and worked closely with these two men. So really looking forward to today.
Thanks, Heath. So unfortunately, Charl Van Wyk was unable to be with us here today. He's unwell and looking after his own health. But if we could start, Dean, perhaps with an overall picture of men's health in Western Australia.
Well, look, men's health overall is below average in their wellbeing, but the Australian Institute of Health and Welfare has recently put out a report, one of 4 reports they put out recently. I'd highly recommend any of your listeners to go onto their website and have a look and see if they could find the resource and perhaps order it in or download the PDF. But there's one they produced recently, and it was called the 5 most at-risk groups of Australian males with regards to their health and wellbeing. And no surprise that rural and remote and regional men are the #1 group of at-risk males in Australia. So absolutely we need to be doing some things about this, and hopefully this is a wonderful forum to do it.
What are the sort of key health issues affecting men in rural areas, Dave?
I think the key health issues that affect men overall are the same in rural and remote, except there's added dimensions in rural and remote. So the male stereotype is probably more obvious in rural and remote, and also the isolation and distance from services is much more difficult. Agriculture and transport are the two of the biggest industries for workplace injuries and workplace deaths, and of course it's pretty hard not to talk about men's health and wellbeing without talking about the impact of alcohol. So that if there's a culture of work hard, play hard and drink a lot of booze, then that's definitely going to play a big impact on men's health, and it's more obvious in rural and remote.
And you said about that stereotype being more pronounced perhaps in rural and remote areas. Often men in rural areas have quite high expectations placed upon them from family, friends, the community. How do you think this differs from men in the metropolitan areas, and how does that extra layer, I suppose, add to those worrying statistics?
Wow, okay. Well, I think there's traditionally males in rural and remote areas would tend to live, because the communities are smaller, because men are more isolated from large groups of other men, but what they'll tend to do, I think, is follow the trend and follow the, like, well, I'll do what my dad did. Well, my dad ran the farm, well, I'll run the farm. Yep. Well, my dad drove a truck, well, I'll drive a truck. So men tend to follow the examples of their forefathers more, obviously, I think, in rural and remote, because there's less opportunities and less chances for them to do different things. Well, that's the opposite in the metropolitan area, in capital cities and in Perth, because in Perth, men can have lots of opportunities and lots of different things that they could possibly do around their work and life choices, etc. So that's one. And the other one is that not only is there the geographic isolation, but there's the social isolation of men in rural and remote. And of course that plays perfectly well, the isolation plays perfectly well with the stereotype of Australian males, which is I'm rough and I'm tough and I can do things by myself, which worked great when we needed pioneers and diggers to fight wars. But in this century, at the start of this century, I think we need less and less of those men.
Thank you for that. Paul, in your work, you've researched and looked at what the term the bro code. Can you explain a little bit more about this and the impact that has on men's health?
Sure. Dean and I have often talked about this rough and tough and ready to bluff stereotype and over the years, and basically the bro code is this concept that like the way that I get to be okay is by hanging out with my mates and being, sort of doing that whole slapstick, taking the piss, drinking booze, talking about women, objectifying women, like being really focused on work and making money. Sort of having that rough exterior that like you get to ratchet up and reinforce with your bros. I mean, it's more of an American term than an Australian term, but in the work that I've been doing, because this concept of masculinities, as it's referred to in the academic world, is actually an international conversation. The bro code is kind of like it's very similar to what we refer to as the mateship stereotype, and there's some really beautiful things about being mates. You get to be able to like hang in there with your friends. And really get to talk about sometimes some pretty challenging stuff, but also to celebrate the things that are going well. There are times when that can actually swing too far into the having fun and taking the piss end of that conversation, and that can prevent guys from actually getting to the real business within them. And it's that piece that's particularly risky, I think, for guys generally, but particularly for rural and remote guys because of the isolation that Dean was referring to before. Do
you think there's parts of that bro code that perhaps could do with some revamping or some changing? Oh yeah, absolutely. Well, similar to what Dean was suggesting is at the beginning of this century, when things have really shifted for guys. I think one of the things that we found, the research indicates this, and also the services tend to reflect it as well, is that it's difficult to get guys to actually show what's really going on underneath that tough exterior. The bro code is very much about like reinforcing the armour, if you like, that men wear. We often talk about, that toughen up princess, or like, she be right mate, and suck it up, or get over it, or like, let's go down to the pub. What all of those messages are basically saying is like, if I'm going to be okay, I've got to really put a thick shell on the outside. And I think that what needs to happen is that actually we need to find ways to soften that shell, not rip it off necessarily, because there's places and times when that shell actually has a it serves a purpose. But to actually let it thin, and also find some places where it's okay for a man to let somebody in and see the softness underneath. Because my experience working with guys, both as a coach and as a person working in corporations where this hyper-masculine or the bro code is really reinforced as a culture, what you find is that actually guys really do want to talk about their stuff. It's just a question of figuring out how to let them show it without them feeling like you're ripping stuff out of them. And doing that safely, I would imagine, as well. Yeah. You mentioned mateship, which is a very Australian term. It's when you become a citizen of Australia, they talk about mateship. Wondering, Heath, with that part of our culture, how can that be a positive influence on men's health, do you see?
Yeah, it's an interesting one, and the guys are right. I think if I could revert it back to sporting groups, it's no different. But there is a positive impact on that bro code. I think camaraderie is a really important aspect of a group mentality, and rurally where I've been visiting, the men, they work, and on a Saturday that's their time to release, and it normally is playing footy. And their wives and partners play netball, and it's all a community-based thing. But I suppose the negative side to that is that we all come back collectively to the footy club and we drink huge amounts of alcohol, and then 9 times out of 10 we put the kids in the car and we drive home because there's no access to cabs or getting transport. So I see it as twofold. I see a fantastic positive aspect of that camaraderie that comes together, community coming together, because as men in particular, when things are going bad, we detach. And we detach from those community-based events, and we sit at home on the couch and drink a carton of beer. So the positive aspects there, but still the negativity and the traditions of Australia to be that blokey bloke and drink your carton is still evident.
So you spoke about that shell or that armour, Paul, about being a barrier. Just to all of you, what are the other sort of barriers for rural men when they come across accessing health and wellbeing services?
Well, I might kick that off and say something like there's definitely it's much more difficult for a man to access the same amount of GPs, nurses and allied health professionals. It's much more difficult for that person to do it in rural and regional than it is in the city. In the city, plenty of choices, plenty of options. In the country, maybe hardly any options, and you might have to travel a long distance to do it. So if it's too hard, if it's too far, then it's too easy for a man to go, oh no, she'll be right, I'll either suck it up and suffer by myself silently, or I'll put up with the ailment, whatever the ailment is, and I'll do it when I get to it, because there's so many other things to do around the farm or in the mine or you know, in the whatever job they do out in the remote region. So access to services, I think, is really one of the major things. And in some ways, using modern technology like this is a great example of how we can help get some messages like we're talking about today to men who are isolated and remote and unsure about, oh, you know, I've got this problem physically or mentally, I don't really know what I should be doing about it. Maybe I'll do some research myself, and there's some wonderful websites out there that men can access to find out more about their own health and well-being, but then getting to the service to be able to do something about it. I think probably literally, and WA is such a massive geographical place, so to get to a service might involve driving for quite some distance, and so then you've got to down tools for half a day, lost productivity, who's going to take care of business? Well, if I don't do it, who's going to do it? So all these sort of things are playing on a man's mind, I think.
Yeah, and there's certainly a lot of families and men doing it really tough out in some of the rural areas, in agriculture particularly. And I imagine that's a bit of a barrier, you know, how can you give up that time to look after yourself when you've got all those other things to look after? Is there other barriers?
Well, I'll pick up from where Dean left off and add to that the stigmatisation of actually showing yourself. Like, part of the problem that men generally, this isn't just a problem for remote blokes in the remote regions, but that showing your vulnerable side, what's underneath the armour, can actually be very, very risky for a lot of guys, because we've got this whole thing in Australia, like the homophobia. It's like, oh, you're gay if you're actually, you know, if you're not handling yourself, if you're not managing yourself, then, you know, you're basically...
You're a bit soft.
Yeah, you're a bit soft, you know, you're a bit limp. And that can be a real, a big stigma that a lot of guys will put enormous amounts of energy into avoiding, especially around their mates. Sort of ties into that whole, you know, the underbelly side of mateship. Like I said before, that there's some great things about being mates, and there's also these things that can actually hold blokes back from really getting the help and the support that they need, not just from official services, but also from their friends. So, like going down to the pub, sinking some beers and saying, I'm all right, mate, how are you, is actually not getting to the real business.
Yeah. So I'm just, Heath, what might you notice if a friend's struggling with issues such as anxiety or depression, and how might you ask them if they're okay?
I think the best way of describing this is I'll use my own personal experience, and I think for me, I used to love training and turning up and being with the lads, and that banter that you have in the change room, there's nothing better. But when I was anxious and also highly depressed, I didn't want to do that anymore. So I took myself away from the things that I actually really enjoyed. There was a shift in mood, there was a huge change. I didn't care about my appearance. I would turn up to training in moccasins and ripped tracksuit pants, where normally I would like to present nicely. So there was that change. Obviously, there was a huge increase in alcohol for me, and that was to get away from that emotional pain. And normally alcohol, wasn't something that I was using during the week, but it became apparent. And I suppose, look, I wasn't eating. I wouldn't eat for up to 3 days, even during the week, before games. And probably another big one was I didn't want to take on challenges anymore. And that was something that I always would push myself to, was get the challenge, eat the challenge up, be stimulated by it. And that was also something that disappeared. So I think just finding a change in mood, a change in behaviour is some huge red flags. And how to approach that is just be a mate and actually recognise the behaviour changes and go in and have that conversation around, I have noticed this, and not say harden up or, get on with it, recognise the change and be caring on your approach, be caring.
So I have a number of really important men in my life that I care about, particularly as a wife and as a mother of a teenage son. How might I approach a man around those concerns?
Can I kick that one off?
Yeah, go for it.
Oh, my favourite subject. I do talks for a lot of people about men's health and wellbeing, and often I find a lot of caring women who are very interested in their partners, their fathers, their uncles, their brothers, their sons. There's a lot of women out there that care about their families like this, and it's a wonderful thing. However, there is something about a woman who's paying too much interest and a little bit too concerned about her man doing something that she thinks is the right thing to do. And in some ways that could possibly almost take it away from, I gave a talk at the suicide prevention seminar recently, and one of the things I encouraged people to have more awareness about is give your man some responsibility to sort things out for himself. Don't be in there all the time doing it for him. Because every time a woman or his wife does, or daughter or mother, does something for that man, he's not learning how to take care of himself, because oh, mum will always do it, or mum always does that for me, or la la la. Now if mum's not there, it's like it's taking away the man's health literacy. So encouraging the man to take some steps for himself, and then holding a firm line on a firm boundary, and saying, for example, one thing, right? If a man's 40 or over, if he went to the GP once a year, we could save thousands of men's lives. Thousands. Now, if you're a woman, wife, mother, daughter, whatever, in relationship with a man, and you care about his health and well-being, then you say something like this: I care about your health and well-being, and I'd really love you to go and have an appointment with the GP once a year. Okay, it's like just go when it's your birthday or whatever. Now, if he doesn't take that opportunity and doesn't do it, well, it's not just like, oh, well, okay, fair enough, maybe next year. No bloody way. So women need to be a bit more fierce about this and hold the line and say, have you been to the GP this year? No. I mean, this year.
Mark it on the calendar.
Yeah, well, I mean, go around your birthday. I always go around my birthday. It's a good reminder. We've got this poster in the office that says, share your birthday with your GP. Go and have the annual check. Most of the chronic illnesses and diseases that are killing men in large numbers, which cause us to have a much lower life expectancy, could be treated and prevented and treated by lifestyle concerns and lifestyle adjustments, healthier lifestyle, and also if they're caught early enough, they can be treated well. So to get back to your question, I think women need to give a bit more responsibility to the men to take care of themselves. It shouldn't always be women's business. Okay, when they're children, but from 16 onwards, it's like you've got to start growing up and taking care of yourself now.
Absolutely.
And that absolutely means a regular visit to the doctor for men over 40 every year. And I think women could probably be a bit more fierce about that boundary and have that expectation and say, and look, this is just not okay, because every year that they don't go and see their GP when they're 40, you might as well start taking a couple of years off their life expectancy.
Thank you.
Yeah, one of the things that we often joke about is how much we learn from the women that speak with us about what's going on for men. I mean, some of the most informative and richest conversations that I've had about men's health and well-being have actually been with women who are asking exactly the questions, the question that you've raised, because there's clearly this deep care, this deep commitment to seeing men's lives go well. And like Dean was saying, it's actually the man's responsibility to take care of himself. And I think that similarly, men need to actually step into that responsibility and really take it seriously, take their own health and well-being seriously. One of the common things that I hear from women is, especially if it's a heterosexual relationship and you've got kids together, is and say the relationship's a little bit rocky, is the woman will say things like, you know, I've got 1 or 2 or 3 kids. I don't want another child called my husband or partner. I actually want him to, you know, to be, you know, standing alongside me and giving me a hand, as opposed to me spoon feeding him. And that's actually that's one of the main complaints, if you like, I hear from women who are on the edge of leaving their partners, is that they've tried to drop hints or encourage, and the guy hasn't picked it up and taken that responsibility on that Dean was referring to. And it gets to a point for many women where they feel like, you know what, enough is enough. I've already done my kid raising, now it's time for me. And if you're not going to like be an adult in this relationship as well and manage yourself fully and be standing alongside me, then off.
And it sounds like from what Dean was saying that it's about being quite upfront about that and holding that line and being really clear, not dropping hints, saying the words. Heath, did you want to add to that?
Yeah, I like the forceful nature. There was no way I was ever going to get help, ever. And my mother, God bless her, she pretty much gave me an ultimatum. And that was, you are going to rehab whether you like it or not. Now, at that stage, I didn't want to go. And I didn't take ownership at that time. The only probably real reason I went was because she forced me and there was a lot of public humiliation around. But that forceful nature got me into rehab and started the process rolling. And going there meant I learnt a lot about myself. And that was something I'll always cherish with my mum, is that she got me there.
If I could add one other thing that just popped into my mind, one of the things that I've also heard a lot from women is that actually men's anger can be really frightening for a woman to confront. And it's often the case when a woman is being more fierce with her boundaries with a man in her life, that the guy can actually give pushback, and that pushback can actually come in the form of anger or frustration from the guy, basically, you know, don't tell me what to do, and you know, and that can actually be quite scary for many women, and that can present like a lot of resistance to having the direct conversation. And that's where they're like, well, I'm just going to do the softer and gentler approach of dropping hints and see what happens. And then often, if nothing more commonly than not, nothing happens in terms of the guy taking responsibility, and the woman just gets fed up and then leaves. And that's often when I get to see guys, is when the woman has left and his life falls apart, or if he's actually starting to take responsibility for himself and looking for the next big thing. And that's where we get to work together.
And you know, in a partnership, being able to leave is an option. As a mother of a teenage son, or with your father or your uncle, those options perhaps aren't as easy to take. I would imagine, as in with most communication rules, one of them is not doing it in the heated moment or where the crisis is happening. Perhaps taking some time and finding a space to have that discussion where the emotions are a little less heated.
Yeah, and can I add something as well? I think one of the things that's really crucial is that with regards to men's health and well-being in rural and remote regions, is that women and families need to make conversations about male health as normal and as usual about the conversations of women's health, kids' health, children's health, we need to normalise conversations about male health. So let's start talking about depression, let's start talking about the prostate cancer, let's start talking about the drinking problems, let's start talking about the whatever else is showing up in a man's life, and let's normalise it. It's like we've got to bring the men in and start having those conversations. Because at the moment, the women and children hang around and they gasbag and talk about all sorts of things sometimes to do with their health and well-being. The guys stay out in the field, working hard on the tractor, they talk about the footy. And they're not paying attention to their some of the symptoms and some of the stuff that's going on for them.
Yeah, Heath, you were struggling around some of these issues from quite a young age. What advice would you perhaps give to young men who may be struggling with depression, anxiety, alcohol use, etc.?
My advice is to tackle it head on and to know deep down that you're not alone. It gets to a stage, if you do it on your own, you do find yourself in that hole where you don't seem to have too many friends and support, but it's all in your head. And there are so many services out there where you can access help. And I urge, at a very young age, if you are feeling these emotions and feelings, that you jump on the internet and you educate yourself about yourself and work out quickly. I was far too old. I was 26 before I investigated, and thank God I did. But I should have investigated at the age of 16, where those changes were happening. And I believe the internet, the surveys that are out there, I ticked a lot of boxes under depression and anxiety, and it slowly started to make the ball roll. The internet is a fantastic tool to use. Yes, it can be, you can type in your symptoms and you can have a sore toe and it tells you you're gonna die at times. But in the whole, not such a bad tool to use, and just to know you're not alone. There's heaps of us out there.
And that can certainly be a really good starting point, but as you said, also trying to talk with other people who might be able to sort out some of the information that happens on the internet, I would imagine is the next step.
Absolutely, it was just a starting tool for me. And that communication, and I mean now, today, the only way I get through from day to day is I communicate with anyone. And we've had a discussion this morning, and it's just the way it is to debrief yourself every day.
Could I add just one piece to that, which is that, like, coming back to that bro code thing, that there's an expectation that, like, men are supposed to be really courageous and strong, and I would suggest that actually it's a very courageous and strong thing to talk about what's really going on inside of you.
Absolutely.
And that's that's one of the key pieces in terms of breaking down the stigmas of what it means to be a man in this world. Is to actually have the courage and the honesty to show your vulnerability at the appropriate time in the appropriate place with the appropriate people, whether that's a professional in support service capacity or with a trusted friend or family member.
Why do you think, and we've brought up alcohol in this space, and obviously other drugs come into that as well, why do you think so many men turn to alcohol and other drugs in response to struggling with mental health, depression, anxiety and such issues? Anyone jump on that one?
Yeah. Within this country, I think we're definitely brought up tough. There's no doubt about it. In rural, remote areas, lead from the front. And if you're a miner or a farmer, you're a strong bloke. And definitely sometimes the only way to escape and numb those emotions is to drink alcohol or take drugs. And, Dean's right. What happens in the past is often what you take up. And I challenge, and I do when I'm on the road, is I challenge those behaviours, and everybody does have a choice. And you can break your family tradition of whether your father was violent or an alcoholic. It is actually up to you. It's a hard challenge to take on, but it is something that is the most rewarding thing. And in particular with my two children, they know that they have the opportunity through education that alcohol and drugs isn't the first port of call when things go bad. And they have the opportunity to change our family culture, which is alcoholics and violent men. And that's something that is really pushed on my two boys. So traditions are there, but that doesn't mean that we're not getting better. I believe through education in the schools that I visit, the children give me hope because they are far better educated than our generations and the generations above us.
And it's that education around their own self-awareness, their emotional well-being,
Yeah.
and a language and understanding of that
Yeah.
that I
Yeah.
certainly see with my own son.
Yeah, it's developing emotional literacy and getting in early to actually give a young fella an opportunity to have those skills really get better down in his normal way of communicating and interacting with others. And we haven't done a good job of that in Western society generally, and especially here in Australia and out in the regions. It tends to be like, get the armour on him as quickly as you can. And what we're talking about here is actually quite the opposite.
Can I add something about that as
absolutely,
well? Sorry. I agree with what's been said about alcohol. It is a massive problem, and our governor here in WA is taking the lead with this one and doing something about it. Malcolm McCusker with the Youth Action Coalition for Alcohol Awareness, and I haven't got the
That's
name
okay.
right, but it's quite a long one. But if the governor's prepared to do something about it, and Fiona Stanley's prepared to do something about it, and they've got those wonderful ads on TV now with the, what's that Aboriginal guy's name who dresses up as a woman and does that? He's a comedian.
Mary G.
Mary G does those
Great
ads
ad.
and says, look, hey, it's not okay to be drinking while you're having, while you're thinking about starting a family. Bloody brilliant. That stuff's so fantastic. And there's two things I want to add about alcohol. Yes, it is a massive problem, and yes, we do need to start doing something about it. But here's two things I'd like to offer specifically for blokes in rural and remote and region. One is we need to find other ways to deal with our stress apart from drinking or smoking or eating terrible food, but let's stick to the drinking for now. So deal with our stress in other ways than just turning to a glass or a bottle or whatever, and start developing other habits around managing our stress. The second part, absolutely related to alcohol as well, is we need to find other ways to celebrate in our community without the use of alcohol. Why every time we have a party it's got to be booze? It doesn't have to be booze. There's so many other ways we can celebrate our achievements and our results and the end of a working week, etc., in a healthy way that doesn't have to revolve around getting pissed, for want of a better word.
Yeah.
So different ways to celebrate and different ways to manage stress, especially for men.
Fiona, just very, very quickly, I was in the middle of the outback of WA, and it was on dusk. I think it was a Friday afternoon around about 5 o'clock, middle of nowhere, no phone reception. And I drove past this homestead, and there was a man out the front, Blundstones, the whole farming kit, with his golf stick, hitting at a pin. And I thought to myself, Friday afternoon, around 6 p.m, and I should have turned around and gave him a clap. But amazing scenes.
Yeah. If I could add a piece also, is that coming back to this question of drugs and alcohol, basically what these substances do is they serve as medication, and what they're doing is that they're substances that push down the terrible feelings that many men are carrying within them, that are rumbling around underneath that armour that I was talking about before. And a lot of those feelings are actually rumbling around, especially because many guys are doing things that are not just hurting themselves but hurting others, especially the people that they love the most. And so what the substances do is that they're basically medicating a man from actually noticing just how terrible those feelings are of when they do things to hurt themselves and others. So in other words, that actually when a guy ignores those feelings inside, it comes at a terrible cost to other people in his life, especially his family and loved ones, but also to himself, often taking years off his life.
Absolutely. And you've spoken a little bit, I mean, Heath, you spoke about the man, out there with his golf stick at 6 o'clock at night, and you've also spoken, Dean, about the work McCusker's doing, and Mary G. What are some of those other initiatives and strategies that rural communities can put in place to promote better men's health and well-being?
The positive that I've seen on the road is the impact that men's sheds are having. And it doesn't necessarily mean that groups of men come together to the men's shed and drink alcohol. I've seen men's sheds that are alcohol-free and work really well, whether it's in the garden or it's restoring a tractor or a car. And when the men come together, they know they're there for a purpose, and usually it is when they're digging a hole or planting a a lemon tree or whatever it is, they're talking about their problems.
Yeah.
And that has been overwhelmingly the most positive thing that I've seen rurally for men.
Yeah.
And I would imagine in men's sheds there's a real opportunity there for older men to be working with younger men around passing down those skills and also being able to talk about what's going on and help them.
Relationships,
Yep.
that's a huge talking point from what I've viewed. And yeah, you know, there's men's sheds where there has been 30 youth from schools, and the men were taking them around, showing them general basic mechanics, which the younger generation aren't really that good at.
Yeah, which ties into this whole notion of father hunger. We've talked about this amongst ourselves many times before, which is like part of what's happened is that many families are now separating more commonly. The rates of separation and divorce are much higher than they were for the previous generations. And a lot of guys will actually reach for drugs and alcohol and hanging out with their mates as a way of sort of trying to fill that father hunger. And I think the point that Heath is raising is the importance of mentoring and having healthy rites of passage as opposed to rites of passage that are risky. Driving fast cars, you know, doing crazy stuff on your motocross bike. Those kind of behaviours, yeah, they can be fun and really give a guy a lot of exhilaration, but it can go too far. And in the absence of actually some healthy relationships with older fellas, you often find that younger fellas go and find ways to recreate those rites of passage or those mentoring relationships, maybe in not so healthy ways.
Is there other initiatives, Dean, that you see from Man and in the communities?
Excuse me. I get a lot of information and contact from people who work in occupational health and safety in mining companies and positions like that. So they're responsible for their human resources, for want of a better word. And they are starting to implement more and more programs now. So there's healthy eating and exercise, and there's a lot more awareness, which I'm really happy to see that sort of thing is starting to take place, because employers are realising that it's that a sick person or someone who's down for some reason or hungover or injures themselves at work, and you know, they don't want injuries and deaths in the workplace. So employers are taking some deliberate steps to do something about this. So I see workplaces as a place where there is starting to be some new conversations happening, and I think that's really great. And of course the other circle where men will be, apart from in the workplace, is at home and in the family. So I think the other place to have the conversation is in the family. And I think more and more, thanks to people like Heath writing a book and talking about their stories, etc. Glenn Mitchell, also the ABC sports commentator, former, going around the state and doing talks, disclosing about his struggles with his mental health, etc. Fantastic opportunities for people to realise that, oh, I'm not the only one that's struggling with stress, alcohol, whatever. The Australian male stereotype of I'm rough and tough and Superman. So having those conversations, and with regards to the family conversations, which relates back to your question before about the women, how can women play a part? And if there are women listening, I'd really encourage them to start doing this, is encourage men of all ages to start having these conversations about the elephant in the room. The elephant in the room is no one's talking about granddad's drinking problem. No one's talking about dad's working 60, 70 hours a week and never home. No one's talking about how teenage son is driving his car and he's just lost his licence 3 times in a row for drink driving and speeding. No one's talking about this stuff. We need to start talking about this stuff, and it's okay to talk about this stuff. What's causing the stress? What's causing the isolation? What's causing the self-medication? So we need to start having these conversations about the elephant in the room in the family circles, over the dinner table. Now I know it's going to be difficult, and of course we're going to feel anxious and nervous about, oh gee, I don't really want to bring up that problem, because what if they don't like what I say? What if they get upset? Well, you either do it now and have this conversation and get over this little hump of difficulty, or look forward to losing your grandfather or your husband or your son. It's as simple as that.
So unfortunately, you know, we've had a really great conversation today around men's health, but we do need to wrap things up. I'm sure we could have a number of panel discussions around men's health. But before we say goodbye, what would each of you like the audience to take away from today?
Well, I'll kick that off if it's okay. I'd like the audience to take away some hope and some inspiration, hopefully, that if I can do it in my family, then you can. If Heath can do it in his family and his work situation, then you can. We're not necessarily special people, we're just people who've woken up and taken some initiative for ourselves, and a lot of men need to wake up and take these initiatives for themselves, ourselves. There's 2 points I want to make in closing. One is our website, which is www.man.org.au, has wonderful resources on it, especially the Blokes book, which is a list of all the resources available for men and boys in WA. Please have a look at that, and there's plenty of things in there, great websites, etc., to go and look, and then start doing some self-exploration and find out for yourself about where you can go, what you can do. A lot of this stuff you can do yourself in the comfort of your own home. So that's one thing. The second thing is it's okay not to be Superman. Did you hear that? It's okay not to be Superman. Let's take off the cape, take off the tight shorts and the tight outfit and the big S on the chest, put that to rest for a little while and start being a bit more human. So men need to take care of themselves and look forward to being healthier and happier and well into their 70s and 80s. We want healthy grandfathers and healthy elders who are happy and well. And my challenge to the men who are watching today, of all ages, is I challenge you to be healthier and happier than your father. That's
Thanks,
me.
Dave. Paul?
Yeah, there were 2 points actually that I thought of that I wanted to mention before we wrap up, which is in reference to the fly-in, fly-out presence here in WA. It's a particularly unique situation. A lot of people who are living in the rural and remote regions are dealing with the economic decline of agriculture by getting into mining, still living rural and remote, but actually flying in and flying out. And that adds another whole layer of these issues that we've been talking about, of isolation, not eating as healthily as you could, loss of exercise, disconnection from the family. And there's 2 things to address there. One is to actually tune into yourself and the impact of that life choice on yourself and your family. And the other is that if there are any employers that are listening, that there's actually a lot of responsibility that they can take to help men and their families actually address these issues more fully. And there's this whole notion of onboarding or helping guys get skilled up and prepared for a fly-in, fly-out roster that includes the soft skills development, tuning into themselves and their families, and also their communities, their commitment to sport and those kind of things that keep their lives rich so that they're not losing that momentum. The second thing I wanted to mention was that not every man is in a relationship with a woman. Some men are in relationships with men and want to be in intimate relationships with men. And the rates of suicide and self-harm, isolation for gay and bisexual men in the rural and remote regions is actually higher than it is for gay and bisexual men in the cities. And what that speaks to is just how intense the stigmatisation and the homophobia is out in the regions. And I want to add to Dean's challenge by letting those guys that are listening that do want to have intimate relationships with men know that it's okay, that you actually can reach out, have those relationships and get the support that you need, and not reach for the medication and live those parts of your lives in the shadows. The final thing I'll say is that I offer coaching services for men, both here in the city and also in the regions. I come out to the regions. I also do a lot of my sessions by Skype or by phone, and you can get in touch with me by checking my website out, which is at menaliveaustralia.com.au.
Thanks, Paul. Dave?
I'll keep this fairly brief. I think, backing up on what Dean said, and one of my main mottos is that everyone's got a choice and the challenge is to change, and I live by that, and I challenge those people as well to, you don't have to be like your dad and your grandfather, or if it's your mother. You don't have to aspire to be like them if they're using drugs and alcohol to cope. So that's a main point. And also to be able to talk about what I say is the S word, and that is suicide. And that's one of my major passions, is that back 20 years ago we used to talk about, we would never talk about cancer. And have a look at today, the way we can openly discuss it. I have the hope that the S word, in a very small amount of time, can be opened up and spoken about, in particular in rural areas, because people still have the stigma around taking their own life. So I urge people to have those conversations. But thanks for the opportunity today.
Yeah, indeed. Thank you.
And as I said, I mean, we've only scratched the surface on some of these issues, and hopefully we'll be able to have another men's panel in the future. We'd really like to thank you all. It's been an absolute pleasure, Dean, Paul and Heath, to have this interview or this panel discussion with you today. And the Rural InReach program really looks forward to seeing you all next time.